Good morning. Welcome to April's edition of CSG University's Spotlight On. I'm here with Andrea Garcia from Kessler Institute, who just did a wonderful presentation on hand, wrist, and elbow injuries. Good morning.
Good morning.
And thank you for coming.
Absolutely. Thank you for having me.
Tell us a little bit about what some of the symptoms are for hand, wrist, and elbow injuries that you see on a day-to-day basis.
I think primarily the first thing that comes to mind is pain. Absolutely. There's also weakness sometimes, and numbness, tingling, pins and needles, I would say.
Very good. And some of the common causes for these injuries?
There's always a traumatic aspect to injuries, the trauma, the falls, slips and falls, but there's also nerve compressions when just the nerve is compressed either by activities that you're doing or just anatomy, and then there's the repetitive use injuries, the tendonitis, the tenosynovitis injuries.
I know you talked a lot about carpal tunnel and some of the occupations. Of course, we do a lot of workman's comp claims here, and I know we work with you and Kessler on some of these claims. What are some of the repetitive motions that you see, some of the occupations for the...
I would say a lot of the office work with the typing, you know, if they're not able to maintain their wrists at a certain angle, any kind of repetitive gripping. Sometimes I'll see like janitors that have to, or mechanics, people that have to do a lot of gripping, forceful gripping repetitively. Those types of things will cause carpal tunnel syndrome.
Very good. And I noticed in your talk that you gave, you did see that you are seeing more surgeries nowadays versus more conservative treatment. Does that seem to be more effective once the patients get to you? I mean, how do you view that?
I think because they're so, it's gotten so easy to do that surgery, and it's so quick, and people recover so quickly from it. I think that that's why they're doing it, and typically people do very well after the surgery.
Very good. What are some things that people can do to try to avoid these types of, do you give your patients any?
We do a lot of education on modification. Yes, I try to educate all of my patients about the anatomy of where the problem is, what's going on under the skin, and it's a lot of modification of activity and sometimes modification of your environment. Is it adding a gel pad to the keyboard to help bring your wrists into the proper position? You know, is it changing the way you lift the laundry basket to avoid further stress on the area that's hurting?
Okay. Very good. You had talked about a therapy in here, and it really seemed to excite everybody in the room, called a mirror therapy. And if you wouldn't mind just taking a couple minutes to explain what that was,
Sure.
it was a really neat, you know,
Absolutely.
part of aspect of your talk. So
great. It's one of my favorite things to do. Mirror therapy is a component of graded motor imagery, and graded motor imagery as a whole is a non-medicinal, non-provocative modality that we're doing with our patients with chronic pain syndromes like CRPS, like phantom limb pain. And quite frankly, there's some very latest research that's showing that just in orthopedic, like a broken finger, just without the pain syndromes, they're seeing benefits from it as well. So we are using mirrors to hide the affected limb. If you have a wrist fracture on the right side, we would put the right hand behind the mirror, and then we would use the left unaffected hand in front of the mirror, and the patient is instructed to watch the reflection of the unaffected limb. And what it does is it reroutes the pathways to the brain that are, the brain is telling you that you're in pain and you can't move your limb. And so we're kind of tricking the brain by rerouting those pathways to say, oh, I have two normal unaffected limbs, and people are getting better quicker.
very exciting.
It is.
Very good. Well, is there anything else that you'd like to share with the audience today about what you're seeing in your day-to-day?
I hope it was helpful, and I appreciate the opportunity.
And we appreciate you coming in.
Thanks.
Well, thank you again,
Thank
and
you.
have a great afternoon, everybody. Thank you for joining us today. you.